Delegates, it's been a whirlwind few months. We have set a pace of delivery that has left our opponents reeling, and certainly in the case of Labour, more than a little confused. A month ago in the Scottish Parliament, they had their first opposition debate under the new leadership of Wendy Alexander. You would have thought they might have opted to put forward some new ideas, debate some radical new policy agenda. Not a bit of it. Instead of making a positive contribution, they spent the whole debate attacking us. Now, as you know, our government has been credited with hitting the ground running after the election. What we have in Labour is an opposition that hit the ground moaning, and believe me, they haven't stopped since. The main thrust of their attack is that there are commitments in our manifesto that we haven't yet delivered. Well, of course, we have not yet fulfilled in our first 5 months in office every single one of the commitments in our 4-year manifesto. But delegates, we have made a fantastic start, and that is how we mean to continue. Let's just remind ourselves how much can be achieved when Scotland has a government with courage, vision, ambition and a determination to act in the national interest. Vital A&E departments at Ayr and Monklands hospitals saved. Backdoor tuition fees abolished. Tolls on the Tay and Forth bridges on the way out. Personal care payments increased. 300 more teachers to start cutting class sizes delivered. Free nursery education increased. More progress from the SNP in 5 months than Labour and the Liberals managed in 8 whole years. That is the reality of our SNP government. But of course, delegates, there is much more to do. And day by day, we are doing it. Just yesterday, I announced the introduction of a cervical cancer programme that will see every teenage girl in Scotland who in September next year is under the age of 18 receive vaccination against this killer disease. That will benefit 120,000 more girls in Scotland than originally planned, and it will save lives. Delegates, when I became Cabinet Secretary for Health and Wellbeing, a few people asked me, wouldn't you have preferred an easier job? Well, forget the obvious answer. There are no easy jobs in government. And anyway, it's the First Minister who decides who does what. That's what we tell him, anyway. Delegates, the real answer is that I can think of no more exciting challenge. The NHS is a fantastic organisation. The doctors, nurses and all the other staff who work in it are first class. Delegates, we owe our NHS staff a huge debt of gratitude. But delegates, we owe them much more than that. We have a duty to protect them from the actions of the mindless minority who abuse and attack them. The brutal knife attack on a GP in her surgery in Glasgow back in August was absolutely shocking. The Emergency Workers Act, passed by the Scottish Parliament in 2005, was an important step forward in giving NHS workers greater legal protection. But it doesn't go far enough. It covers doctors, nurses and midwives only when they are on duty in an NHS hospital. GPs, community nurses and community midwives are excluded. Our manifesto committed us to extending the protection of that Act. I can announce today that we will do so. Before the end of this year, I will lay in Parliament the regulations necessary to extend the Emergency Workers Act to doctors, nurses and midwives whenever and wherever they are on duty. Another promise kept by the SNP. Delegates, I said a moment ago that the NHS is a fantastic organisation. Next year, it will be 60 years old. There will be many events around the country to celebrate that anniversary. Let me tell you what our government will do to mark the occasion. In April next year, we will take the first step towards the abolition of prescription charges, and we will abolish them for all within the lifetime of this Parliament. What better way to celebrate the NHS than by returning it to its founding principle of healthcare free at the point of need? That was the principle espoused and defended by an Iron Bevan. So today, I issue this direct challenge to Wendy Alexander and Labour. Join us in restoring that principle. Vote for the abolition of prescription charges. Delegates, we should celebrate our NHS, but we must do more than that. We must work to make it better and stronger. And we've already started. Last month, I announced plans that will end hidden waiting lists for good by December this year. It's a move that will benefit thousands of patients across Scotland, patients who have been denied their rights for far too long. It was a move warmly welcomed by patients' groups and by many members of the Scottish Parliament. Only Labour MSPs couldn't quite make up their minds what they thought. They managed to both criticise the policy and claim it was all their idea. You know, Labour really is struggling to get the hang of this opposition business. So, delegates, let's make sure that they have many, many, many years to practice. Delegates, I know only too well from the letters I get from right across our country that the time people wait for treatment is one of the biggest causes of public concern. I have already announced on behalf of our government that we will deliver a new whole patient journey waiting time guarantee of 18 weeks by the end of 2011. Now, I know that the Scottish people will expect to see clear and steady progress towards that goal. In the action plan for health and wellbeing that I'll publish in December, we will set out the key milestones along the road to delivering our commitment. Today, I can announce the first milestone. By March 2009, the current waiting time target of 36 weeks will be cut to a maximum of 30 weeks, the first down payment on our commitment to deliver shorter waiting times for everyone in Scotland.